Like and subscribe for daily OT brain boosters. A resident in a SNF with moderate dementia participated in morning dressing. Resident required maximum verbal cues for sequencing and minimum physical assistance to put on a shirt correctly. One of the resident's goals is to complete UB dressing with supervision. Which information is best to include in the A section of the SOAP note? B. Sequencing deficits continue to limit dressing independence, and the resident would benefit from continued task-specific dressing practice. Context: this is the assessment because it explains the reason for the difficulty and identifies the clinical need. Patient in acute care is 2 days status post-total hip replacement. During OT, patient completed LB dressing using a reacher and required moderate assistance to thread pants over both feet. One of the treatment goals is for the patient to complete lower body dressing with supervision using adaptive equipment. Which information is best to include in the O section of the SOAP note? B. The patient completed lower body dressing with a reacher and required moderate assistance to thread pants over both feet. Context: this is direct, measurable performance data, so it belongs in objective. A third-grade student participated in a handwriting task during OT. Student copied 4 sentences from the board with inconsistent spacing and required 3 verbal cues to remain seated. Which statement is best to include in the O section of the SOAP note? C. The student copied 4 sentences from the board with inconsistent spacing and required 3 verbal cues to remain seated. Context: this describes what was observed during the session, so it is objective. Client with left hemiparesis participated in grooming at the sink. Client required M&A for standing balance and 4 verbal cues to incorporate the left UE into the task. Which statement is best to include in the O section of the SOAP note? A. The client required minimum assistance for standing balance and 4 verbal cues to use the left upper extremity during grooming. A 4-year-old child used a spoon during a feeding task. Child scooped pudding with Mod A and spilled food during 3 out of 5 trials. Which statement is best to include in the O section of the SOAP note? B. The child scooped pudding with moderate assistance and spilled food during 3 out of 5 trials. Like, comment, and share. Learned something or nailed it? Follow us to stay OT sharp. You got this.